Good afternoon, everyone. The topic for today's PG activity is the testis anatomy, applied anatomy, and histology. We begin with an introduction to the male reproductive system. The male reproductive system is responsible for the production of spermatozoa and their delivery into the female reproductive tract. It consists of external genitalia and internal genitalia. The external genitalia consists of the penis and the scrotum, and the internal genitalia consists of the gonads, the duct system, and the accessory sex organs. The gonads in the male are a pair of organs known as testis, which is our main topic of discussion today. The gonads produce spermatogonia and secrete testosterone. The duct system includes the epididymis, the vas deferens, the ejaculatory ducts, and the urethra. And the accessory sex glands include the seminal vesicle, the prostate, and the bulbourethral glands. Next, we have the penis and the scrotum. The testis is located inside the scrotum. The scrotum therefore helps to protect the testis, and it also helps in maintaining the temperature of the testis at least 2 to 3 degrees Celsius lower than the normal body temperature, which is the ideal temperature for the process of spermatogenesis. Broadly, the testis can be divided into 3 parts. The first part is seminiferous tubules, where the main cell type is spermatogenic series cells and the SERTOLI cells. The function of the seminiferous tubule is production of the male gametes, which are the spermatozoa, and support the cells which are required for spermatogenesis. The second part is cells, which the main function of which is the production of the hormone, which is testosterone. The third part is RETE testis. The main cells here are the cuboidal epithelium with cilia and a smooth muscle coat. The main function of RETE testis is to convey the spermatozoa from one part to another. Now we come to the anatomy of the testis. The adult testes are paired organs that are oval in shape. The average weight is about 15 to 19 grams, with the right one usually 10% heavier than the left. The left testis hangs slightly lower than the right in the standing posture. It is suspended in scrotum by the spermatic cord so that its upper pole is tilted forwards and medially. The external features of the testis include 2 poles, upper and lower, 2 borders, anterior and posterior, and 2 surfaces, medial and lateral. Now we'll see a video which will help us understand the position of the testis in its anatomical position.
So this is testes, and this is not only the testes, it is also containing the spermatic cord, right? So if you see this testes, this is the main testes, and here the C-shaped complete is epididymis, right? And from one end of the epididymis, we see a big cord is coming like, and this cord is spermatic cord, right? So one should know what are the content of this spermatic cord, and vas deferens is the main content, rest other you should know. Now, in this video, we know how to hold it in the anatomical position. So first hold the testes with this, hanging with this spermatic cord, and this epididymis should be towards your side, and you see this. So if you hang it in this way, now you see this is anterior, this is posterior, this superior end, and this is inferior. Now how to identify the side? Now see which side the gap is present between the epididymis and the testes. Here you see the gap is present small, that is sinus. While if you see, compare it with the other side, you do not see any gap. So this gap or sinus should be laterally present. So this testes belong to the left side.
Moving on to the structure of the testis. As we can see in this diagram, a number of fibrous septa divide the testis into approximately 250 lobules. Each lobule contains about 1 to 4 seminiferous tubules. These seminiferous tubules are said to be the structural and functional unit of the testis. The usual testicular biopsy is composed of 3 to 5 lobules together with portions of the septa. These septa should not be confused as areas of fibrosis. The seminiferous tubules anastomose together to form a network known as a RETE testis, and this RETE testis in turn gives rise to about 12 to 30 ductuli afferentes or the efferent ductules, which form the head of the epididymis, and this epididymis is further continuous with the vas deferens or the ductus deferens. Coming to the blood supply of the testis, the blood supply of the testis is by the testicular artery, which is a direct branch of the abdominal aorta at the level of the second lumbar vertebra. The course of the artery is from the posterior abdominal wall to the deep inguinal ring, then to the spermatic cord, and eventually to the tunica albuginea and the tunica vascularis, which are the coverings of the testis. This artery plays an important role in thermal regulation of the testis via counter-current heat exchange with the veins of the pampiniform plexus, which, like I said earlier, is important to maintain the temperature of the testis lower than the normal body temperature. Coming to the venous drainage of the venous drainage of the testis is primarily via the pampiniform plexus of veins. The pampiniform plexus of veins on either side will join to form the left testicular vein and the right testicular vein. The left testicular vein drains into the left renal vein, which eventually drains into the inferior vena cava, but the right testicular vein drains directly into the inferior vena cava. Therefore, the left testicular vein is longer than the right testicular vein. The left side is more subject to difficulties in drainage and pathological conditions like varicocele, whereas in the right side, it is subject to early spread in cancer because it is in direct relation to the inferior vena cava. Now coming to an applied anatomy aspect of the venous drainage, varicocele is defined as dilatation and tortuosity of the pampiniform plexus and eventually also of the testicular veins. The normal vessels have a diameter of about 0.5 to 1.5 mm, but in varicocele, the diameter is more than 2 mm. Varicocele is more common on the left side than the right because the left testicular vein is longer. It enters at a right angle to the left renal vein. The left testicular artery is also arching over the left testicular vein. There is a crossing over of a loaded sigmoid colon on the left side, and it is also subject to compression between aorta and superior mesenteric artery. Coming to the lymphatic drainage and nerve supply of testis, the lymphatics drain into the pre and para-aortic lymph nodes. The nerve supply is by sympathetic nerves arising from the segment T10 of spinal cord. The nerves are both afferent for testicular sensation and efferent to the blood vessels, that is vasomotor. Coming to the descent of the testis initially develops in relation to the lumbar region of the posterior abdominal wall, but during fetal life, it gradually descends to the scrotum. During a third month of gestation period, it will reach the iliac fossa. At the 7th month, it reaches at the level of the deep inguinal ring. During the 7th month, it crosses the inguinal canal, and by the end of the 8th month, it is usually found in the scrotum. Coming to some more applied anatomy aspects, the first condition is CRYTORCHIDISM or undescended testis, in which the testis does not descend during fetal life and may lie in the lumbar, inguinal, iliac, or upper scrotal region. It may complete descent after birth, but if it does not complete descent, then spermatogenesis may fail to occur in it, and it is also prone to development of malignancies, particularly gonadoblastoma. This condition can be surgically corrected. The next condition is ectopic testis, which is defined as abnormal position of testis due to deviation from the normal route of descent. But the testis in this case is usually fully developed, and it is usually accompanied by an indirect inguinal hernia. The next condition is atrophy of testis, which can result from a number of causes like cryptorchidism, orchitis of mumps, liver cirrhosis, radiation exposure, chemotherapy, and exogenous administration of estrogens or gonadotropins. The tubules in atrophy are small with thick basement membranes with few or no germ cells, and the interstitium will show fibrosis and increased number of Leydig cells. The last condition is vanishing testis, which is an extreme degree of testicular atrophy. In this case, the epididymis will be rudimentary and no identifiable testicular tissue will be found in the spermatic cord. Instead, a dense fibrovascular tissue with a foci of calcification and hemosiderin is present. There is a theory that vanishing testis can result from testicular infarct, presumably in utero. Now coming to the embryology of the testis, which we will try to understand with the help of this diagram. As we can see in this first picture, the testis will develop from the coelomic epithelium or the germinal epithelium on the medial side of the mesonephros. When this germinal epithelium gets thickened, it will be known as the genital ridge. It will give rise to a number of solid sex cords, which are known as the medullary cords. Most of these medullary cords will get canalized to form seminiferous tubules. Some of the medullary cords which are not canalized will give rise to the interstitial cells in the testis. At the same time, primordial germ cells from the endoderm of the yolk sac will also migrate to these medullary cords and get incorporated in the seminiferous tubule, and eventually we will start the process of spermatogenesis in the tubules. The ends of the seminiferous tubules will form a network, and form the RETE testis by anastomosing with each other. The RETE testis will then anastomose with mesonephric tubules to form vasa efferentia, and the mesonephric duct will become the duct of epididymis. Lastly, the mesenchymal cells surrounding the developing testis will form a fibrous tissue which is known as the tunica albuginea. Coming to the development of the testis, it can be divided into 3 phases. The first phase is the static phase, which is from birth to the age of 4 years. The second phase is growth phase, which is from 4 years to the age of 10 years. And the last phase is developmental or maturation phase, which starts from the age of 10 years to puberty. At birth, the seminiferous tubules are compactly filled with small undifferentiated cuboidal cells. The Leydig cells are seen in the newborn due to influence of maternal hormones, but then disappear to reappear only later. At 10 years, the mitotic figures will appear in the tubular cells and Leydig cells again become recognizable. At age 11 years, primary and secondary spermatocytes appear, and at age 12 years, spermatids will appear, followed by the appearance of spermatozoa. Before moving on with the histology, we'll first discuss the coverings of the testis. The testis has 3 coverings. The first outer layer is the tunica vaginalis, which is a flattened layer of mesothelial cells overlying a well-developed basement membrane. It has 2 layers, the visceral layer and the parietal layer. The involvement of the tunica vaginalis in testicular cancer will directly upgrade the stage of cancer from PT1 to PT2, which is an important applied anatomy aspect. The tunica albuginea is composed of a layer of collagen fibers within which are embedded fibroblasts, myocytes, mast cells, and nerves. The last layer is the tunica vasculosa, which is a loose connective tissue containing blood vessels and lymphatics, which will send septa into the testicular parenchyma to form the individual lobules. The tunica vasculosa is a common location to identify lymphovascular space invasion by germ cell tumors. An important applied anatomy aspect here is testicular torsion. The torsion of the spermatic cord and subsequent loss of blood supply to the ipsilateral testis is testicular torsion. It is a urological emergency. Normally, the tunica vaginalis does not completely surround the testis. It is deficient on the posterior aspect. But in Bell-Clapper anomaly, the tunica vaginalis will completely surround the testis and the spermatic cord, which predisposes it to torsion. Another cause of torsion can be poor or absent attachment of testis to the scrotal wall. Now we come to the histology of the testis. First, we will take a look about the spermatogenesis process. The first cell in the process of spermatogenesis is the primordial germ cell, which will form the spermatogonia by the time of birth. At puberty, the spermatogonia are present in the seminiferous tubules. They are activated to undergo mitotic division and give rise to the primary spermatocytes. The primary spermatocytes will undergo the first meiotic division, with each primary spermatocyte giving rise to 2 secondary spermatocytes. Each secondary spermatocyte will undergo second meiotic division to give rise to 4 spermatids, and the spermatids will undergo the process of spermiogenesis to eventually give rise to the spermatozoa or sperms. Now we'll take a look at a cross-section of the seminiferous tubules, which are the sperm factories. The seminiferous tubules will have germ cells in varying stages of differentiation and the SERTOLI cells, which are the supporting or the nurse cells. Each tubule has a distinctive basement membrane and a thin lamina propria. At puberty, this tubule gets divided into 2 compartments, the basal compartment and the luminal compartment. As we can see in this image, the less mature forms like the spermatogonia, the primary spermatocyte and secondary spermatocyte will be found adjacent to the basement membrane, that is in the basal compartment, and the more mature forms of spermatids or spermatozoa will be found near the lumen or the luminal compartment. The first type of cells are the spermatogonia. They are of 2 types, type A spermatogonia and type B spermatogonia. Type A spermatogonia undergoes several cycles of mitosis to form more type A spermatogonia and maintain the germ cell pool. They have a large round or oval nucleus with condensed chromatin, peripheral nucleoli, and prominent nuclear vacuole. The second type of cells are the type B spermatogonia, which are actually committed to the production of sperms. They have dispersed chromatin, central nucleoli, and no nuclear vacuole. The next type of cells are the primary and secondary spermatocytes. The primary spermatocytes are recognized by their copious cytoplasm and large nuclei containing coarse clumps or thin threads of chromatin. The secondary spermatocytes are smaller than the primary spermatocytes, but they rapidly undergo second meiotic division and are therefore usually not seen. The third type of cells are the spermatids and the spermatozoa. The spermatids are seen in this image as round cells, and the sperms, on the other hand, are elongated forms. The spermatids undergo a maturation process known as spermiogenesis, through which they acquire a tail and a head, acrosomal cap, and give rise to the elongated spermatozoa. The process of spermiogenesis usually takes place primarily in the epididymis. During this process, the nuclei of the spermatids assume the small pointed form of spermatozoa. The next type of cells present in the seminiferous tubules are the SERTOLI cells. They are tall columnar cells with their bases attached to the underlying basal lamina. They have an irregularly shaped nucleus. They have an abundant but relatively inconspicuous cytoplasm and an ill-defined cytoplasmic membrane. The SERTOLI cells may contain lipid vacuoles and eosinophilic granular debris that represents phagocytosed remnants of the spermatids or degenerated germ cells. The distinctive feature of SERTOLI cells are crystalloids of Charcot-Boucher, which are only seen in adult SERTOLI cells. The difference between adult and fetal SERTOLI cell is that the nucleus in adult SERTOLI cell is round or slightly irregular. It has a folded nuclear membrane and a round nucleolus, whereas the fetal SERTOLI cell has an oval or elongated nucleus, smoothly contoured nuclear membrane, and inconspicuous nucleolus. The SERTOLI cells have multiple functions, the most important being to provide nourishment to all the spermatogenic series cells. Therefore, they are also called nurse cells. The next function is phagocytosis of discarded spermatid cytoplasm. The next is secretion of inhibin, which regulates hormone production, secretion of tubular fluid, and the last being secretion of factors, which regulate the function of LEYDIG cells and peritubular cells. Now we come to the next part of the testis, which is the interstitium. The interstitium is found in the middle of the seminiferous tubules, and this region mainly contains the LEYDIG cells, blood vessels, lymphatics, nerves, mast cells, and macrophages. The principal cell type in the interstitium is the LEYDIG cell. It synthesizes and secretes the male sex hormone, which is testosterone. The nucleus of the LEYDIG cell is round with dispersed chromatin and with 1 to 2 nucleoli at the periphery. The eosinophilic cytoplasm may contain lipid vacuoles and lipochrome pigment, which we can see here. The other important feature is elongated hexagonal crystals of Rinke, which are eosinophilic. These crystals are found only in adults where their function is not known. Next, we come to the last part of the testis, which is the RETE testis. The RETE testis is usually a single layer of low cuboidal epithelial cells with surface microvilli and single cilia. The cilia are important because the RETE testis usually contains the spermatids and they are non-motile. Therefore, for their movement, the cilia are required to deliver them to the epididymis, where they will undergo spermiogenesis and attain motility. Thank you.